نبينا السلام عليك صلوات الله وسلامه عليك يا رسول الله صلوات الله وسلامه عليك يا حبيب الله صلوات الله وسلامه عليك يا رسول الله صلوات
Assalamu alaikum and welcome to another episode of Doctor in the House. I am your host today, Dr. Tawfiq Hussein. And as I previously mentioned, I am a family physician working in primary care in South Trinidad, and I maintain a small exclusive private practice in Central Trinidad. Today we have a very important topic, a topic that affects every single human being. Because from the time you are born and you go day by day in your life, every birthday pass, every year pass in your life, you are getting older, you are aging. So today we want to talk about how to age in a healthy manner, how to keep some of your function as you get older. We know that we have to value 5 things before the next 5. And 2 of those 5 things are applicable to my discussion today. The first one is that we value our youth before old age. So when we are young, we are very enthusiastic, we are very full of energy, going through as teenagers. As we get older, into our 20s, 30s, even 40s, we are very vibrant. We feel like we can conquer the world, we can do anything. But it is important through these years that we prepare for the other part. So we value our youth and before, and we prepare for old age. The other one is that we value our health before sickness. So valuing our youth and having a healthy lifestyle in our youth would prepare us for as we get older. And as we know, many of the diseases that happen, chronic diseases such as diabetes, high blood pressure, strokes, kidney disease, they have an association with old age. As you get older, these conditions become more prevalent. If you go to any chronic disease clinic in Trinidad and Tobago, the average age of a patient, the youngest might be in their 40s, but the average age would be between 60 to 70 years, some of them older than that, right? So we want to value our youth and our health and prepare for old age. Once some of the companions of the Prophet, peace be upon him, they went to him and they asked him about whether it is okay, whether it is lawful to seek medical attention for diseases and any conditions that may arise. And he said that for every condition that was created, there is a treatment or there is a cure, except one. And that one, when the Sahabas inquired, it was old age. So we are not trying to cure old age, but rather we are trying to be healthy as we grow older, right? So we want to add life to our years rather than just years to our life. So many people, you talk to them and you ask them how old you want to live to be. And these people have great aspirations to live old, 80, 90, 100 years. But at this age, the average 80, 90 to 100-year-old, are they able to walk? Are they able to dress themselves? Are they able to do activities of daily living? So it becomes difficult to do this as you get older. That is why it is important to prepare, and we should try our best to age healthily. So this is a short introduction to my topic, and we will go on to the slides now so that we can discuss this a little more. So as I mentioned before, we aging healthily. We want to add life to our years and not just years to our life. So we can live a very long life, but we want to live a long life with a good quality of life, a good standard of living, able to do all our daily activities. So as we go on, we want to talk about healthy aging, understanding why it's important. We mentioned a little bit about that. We want to keep our body and our mind active and healthy. Then an important discussion, something especially important in geriatric medicine. So we talk about the elderly in this instance is preventing falls, and we will see how important this is later on. And we want to know what is the diet like we're supposed to have as we get older, as well as we will touch on some preventative healthcare and some faith-based aspects of aging. So why should we talk about this, right? Why talk about aging? Because we are living in a population that is aging. The Trinidad and Tobago population, we are getting older, right? Because of different factors, having better health care, having better public health systems, and the low rates of certain infectious diseases. So we are living longer, but just simply living longer is not enough. We want to maintain a sense of independence, a sense of activity, to be mentally sharp and able to do everything in our daily life, right? And this would help us in our ability to worship Allah, of course. So the WHO defines healthy aging as maintaining the ability to do things that matter most throughout life, right? So you want to compare yourself to someone that is your age. So if you are 60, 70, 75 years, you want to see whether you could do as much as the average 60-year-old, as much as the average 70-year-old, or even more than that. The aim is to be healthier than the average person, right? So you do not simply just want to live longer, but you want to live better, stay independent, and maintain your sense of dignity as you grow older. So growing old does not mean growing weak, right? So I remember one time Mufti Menk was given a joke, and he said, the Imam said he might be old, but he is not cold. So you don't want to become cool. You want to get old, but remain vibrant and young. So aging is not just about avoiding disease, right? And the normal aging process is associated with certain diseases. And what influences our health as we age is the lifestyle that we have. The lifestyle that we have in terms of diet and exercise, which we will go into a little more detail later on. The environment is important. To have strong support from your community, have strong support from your family, have strong relationships with your family. Medical care is important. When to see a doctor, how do you need to go to the doctor, when do you need to go to the doctor, right? Do you need to get screened for certain conditions as you get older? When you reach certain ages, as we mentioned before, certain conditions are associated with getting older, such as the chronic diseases, diabetes, high blood pressure, high cholesterol, the major killers, the major diseases in Trinidad. So what are the biggest threats to aging healthy? As we go further on, we will see where falls is a major threat. And as I just said, in terms of the diabetes, the high blood pressure, and the chronic diseases, they lead to heart disease, stroke, dementia, which we'll touch on a little later as well, fragility, which is the loss of muscle mass, the loss of function as you get older, loneliness as people grow older. Sometimes society tend to isolate the older individual, which is a big problem for the elderly and the geriatric population. Poor nutrition, so sometimes people are only able to eat the food that they have quick access to rather than getting nutritious meals and having more healthy meals as they grow older, and physical inactivity. So we will touch on how to prevent all of these as we go further on. So one of the major things in not getting old and cold is maintaining physical activity, staying active, because movement is medicine. You get the blood pumping, the blood flowing to the brain, the blood flowing to your limbs, and there are many benefits of exercising, right? Exercising benefits every single organ in the body, right? Even people who might think they have osteoarthritis in the knees, but exercise actually helps. Physiotherapy and exercise helps. So movement is medicine. And it's never too late to start, right? You may lead an inactive lifestyle for so long, and you are 60 years now, and the diseases are catching up with you. As we say, age catching up with you, but it is never too late to start. So the benefits of exercising: as you exercise, your muscles develop, right? Your muscles grow stronger, and this prevents fragility, because fragility with the older individual, you can move on to the next slide, with the older individual is actually a loss of muscle. So if you're starting with a high level of muscle, as you get older and you lose muscle, you would still have enough muscle to carry about your daily tasks, your daily activities, and to live a fulfilled life. It helps with balance, which helps prevent falls. Better sleep, which sleep improves your mood. It also improves your memory as well. So better sleep improves your mood and memory, and then exercise independently increase your mood, right? Because of the chemicals produced in your brain from exercising, they naturally make you feel a little bit more happier, a little more contented with your life, and it improves your memory. So now you might want to know, well, exercise improving my memory. So as we mentioned before, exercise helps with blood flow, and it also helps with blood flow to the brain. And once you have good blood flow to the brain, this helps to prevent dementia and prevent you from losing your memory. It also lowers your risk. Exercising also lowers your risk of heart disease. So we speak about exercise, but how much exercise should I do as an aging person to remain healthy? So the WHO, the World Health Organization, recommends 150 minutes per week, which is about 20-something minutes per day. And it does not have to be done all at once, and it's never too late to start, as mentioned before. So if you want to exercise 10 minutes in the morning and 15 in the evening, or break it up 3 10-minute sessions throughout the day, that is okay. And the intensity of exercise that you should do is moderate to high intensity exercise. How do you know you are doing moderate to high intensity exercises? You will not be able to sing a song when you are exercising, because you will be so slightly out of breath that when you are exercising moderate to high intensity. The other thing, as you grow older, it is important to do strength training at least twice for the week. We're not saying to go to the gym and lift up 200 kilograms or 200 pounds or this type of strength training, but a small 5 pounds or 2 kilograms, or even more than that, what you can tolerate, this would help, this resistance and strength training will help to build your muscles. So as you get older, you can maintain your muscle mass. So simple activities as well are important in getting physical activity in, things that you would do on a day-to-day basis like walking, right? So you can walk around your neighborhood or walk around your house. Just be careful of the dogs that may come in at you. Gardening, a lot of people as they grow older, they find gardening very relaxing and they dedicate a lot of their time to gardening, whether it is flowers gardening or some people like to plant things that they may be able to use in their kitchen. Housework, important. Ladies, their whole life they're doing housework, so as men retire and they go into old age, this is a good opportunity to help your wife to do some household chores so that you can ease the burden on the lady folk of the house and you can get some physical activity in, sweeping, mopping, doing household chores. And another thing, as you find people get older, they are unable to climb stairs, right, due to probably arthritis or a lack of coordination or a lack of strength. So not to run up and down the stairs, but to go a few times up and down the stairs is a good exercise to keep your mobility going. Light weights, as we mentioned before, and stretching exercises would help. Chair exercises will help the individuals who have a bit of limited mobility. They can sit in the chair. Those who might have osteoarthritis of the knees, they may be able to sit in the chair and do exercises from the chair rather than just saying that they are unable to exercise because they cannot walk due to pain. So you can sit in a chair and exercise. That is how easy it is to exercise. So one statement that was made recently is that sitting is the new smoking. So now we all know how dangerous is smoking. Even the smokers now, if they look at the package that the cigarettes come in, it's people who have lung cancer, images of lung cancer, images of limbs that have to be removed because they are so severely damaged from smoking. So how can I make a statement, or how people can make a statement that smoking is the new sitting? Right? Because it is shown that sitting for prolonged periods of time and being sedentary actually increases your risk of heart disease, diabetes, fragility, and early death, probably not as much as smoking, but to similar levels of smoking. So with this in mind, if you are sitting whole day because you know you're old and you don't want to move, and at least every 30 minutes, every 60 minutes, you get up, you walk a short distance, and you come back and you can sit again. It's important to move and not to remain absolutely sedentary. So in a nutshell, that is about keeping active. Now another part of the body as we get older that is affected by age is the brain, right? The brain. So our brain health matters, right? The brain health matters because as we get older, it is very common to have memory problems. Now, this is not something out of the ordinary for an individual to have memory problems, and it might be a natural part of aging. However, dementia is not a natural part of aging. And dementia is the individual that would forget certain important things, right? And that would display abnormal behavior. So they might think that, you know, they are still young, or they might forget their family members who they live every day with. They may get lost very easily. They would forget what they are doing, right? This is the symptoms of dementia, right? And this is not a normal part of aging. However, some mild memory problems like where I put my glasses or where my keys, you know, that is acceptable, but not the symptoms of dementia. You need to seek help if you're having those symptoms. So how do we reduce the risk of our brain aging in this way where we develop dementia? So we want to control certain risk factors for dementia. High blood pressure, diabetes, cholesterol. We could put all of those in one bracket. You want to control those things, right? And all of those things cause problems to the brain in one particular way. So recently I was attending a lecture in a mosque where a doctor was giving a talk on high blood pressure. And he said controlling the blood pressure decreases your risk of dementia. So after the talk, when they had the questions and answer section, one person said, but I don't understand why controlling my blood pressure and how controlling my blood pressure would prevent me from developing dementia. So there are different types of dementia, and the type of dementia that controlling your blood pressure would protect you from is what we call vascular dementia. So we all know about strokes, and strokes is where one of the major blood vessels in the body, in the brain, gets blocked. However, these diseases such as high blood pressure, diabetes, and cholesterol could block the very, very narrow blood vessels and very small blood vessels at the end of the blood vessels and kill very small parts of the brain. So you're having mini strokes that affecting small parts of your brain that would be responsible for your cognition, your ability to think, also your memory, your ability to remember stuff. So this is how diabetes, high blood pressure, and high cholesterol could affect you getting dementia. So that is why we need to have these things under control. We also want to exercise regularly, as we mentioned before, sleep well, and avoid smoking. Always know the dangers of smoking. So as you get older, one of the important things you have to do is to challenge your brain, learn new things, read new books, right? Learn about things that you didn't know in your younger age. Because growing old is also an adventure. You want to grow old and be happy in your old age. So you want to learn new things. You learn from the cradle to the grave. Read more Quran, memorize more Quran, right? There's important stuff. You may be surprised to know how many older individuals memorize large portions or even the entire Quran in their old age, because verily Allah has made the memorization of Quran easy for the believers. So you want to learn new skills, or even on your phone you could download a strategy game, or there are memory games now on your phone. And playing these simple games, I mean, do not waste away your time playing the games, but playing these simple games could help you to increase your memory and build your mental capacity as you get older, to keep your function as you get older. It is important as well to be social. And how does being social affect your mental health? When you are social, this decreases the risk of depression because you are not isolated. And there are cases of individuals who we think have dementia because they may be forgetting, or they may be not talking as much, and they may be, displaying symptoms of dementia, but then we realize they are depressed due to isolation. Older individuals are always at risk of isolation socially. So this is where the younger viewer comes in and the families come in, where you have your grandfather or an older uncle. You always want to go and give them a phone call, or go and pass and check them. Make sure they are okay. The chacha that you might see in the back of the mosque sit down on the chair that nobody just go and talk to, you go and talk to him and find out how he's doing. He may have a problem that you as an individual in the community may be able to help him with, right? And you want to have respect for your elders. So you want to stay involved with family, community groups, right? And in the masjid. So what are the warning signs? How do you know you need to go to the doctor to get a proper assessment, especially as we talking about dementia, right? And your memory. What are the warning signs to think that your relative or your mother, your father, your grandmother, your grandfather needs to be assessed? Those signs are if the memory loss affects their daily life, right? So they will not be able to do certain tasks, so they might forget that they have to eat. And you say, Grandma, you eat breakfast, and then she cannot remember if she ate breakfast, right? Or even simple things that, and people might find it a bit humorous, but Grandma, you smell a little bit. You bathe? Did you bathe for today or yesterday? And these kinds of things that their memory affecting their daily living. Some individuals who drive, they may go down the road to buy a bread. So they start the car, they go down the road to buy a bread in San Fernando, and they get lost, they end up in Chaguanas, right? So getting lost or wandering away from home, that is another red flag that you need to see a medical professional. Changes in personality, right? So a person who may be very mild-mannered and quiet, they become aggressive, right? They're using certain language that they wasn't to use before, right? They're involving in certain activities that they might not be involved in before. And another one where older people are preyed upon is where people, they have they have difficulty in managing their finances, right? So they know they have their money and they want to do certain things, but they may go and pay more than they're supposed to do for certain things, or some people may take advantage of them financially and con them out of their money because they mightn't be able to see or understand what is going on. So any difficulty managing their finances. So with all of this in mind, we want to go to a commercial break, and when we come back, we will be discussing a bit more on falls, a bit more on the diet of the elder person, and some faith-based aspects. So see you when we come back.
Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab an Oasis, now why wait? Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab an Oasis, now why wait? The greatest, the safest, Oasis for sure. Oasis, it's purer than pure.
Fruitopia, the drink that rocks your lunchtime. Fruitopia, Fruitopia, it's a drink that's hype. The citrus punch, fruit punch tastes nice. Guava, pineapple, that give me a vibe. We no want nothing less compared to the rest. Fruitopia the best. Punch any thirst when it comes to the test. Perfect thing for my lunch. Flavors pack a punch. Fruitopia, Fruitopia, it's a drink that's hype. The citrus punch, fruit punch tastes nice. Fruitopia, the drink that rocks your lunchtime.
Try our new passion fruit flavor today. Taste the passion.
Welcome back. And as we were discussing before the break, we are talking about growing old healthily. So an important factor that most of the geriatric doctors, the doctors who deal with old people, they talk about is preventing falls. Right, because falls has a great risk in the older individual. It has a high morbidity and mortality, and 1 in every 3 adults over the age of 65 fall every year. And fall is the leading cause of hip fractures and disabilities and loss of independence in the elderly population. So, as I say hip fractures, that reminds me of an incident that happened when I was an intern back in 2019. I was working in the orthopedic ward, and you know, they say when certain medical conditions come, they come in threes. So that night when we were on call, I admitted 3 elderly females, one in the 70s, one in the 80s, one in the 90s, who had hip fractures. One fell out of a hammock, one slipped, she had diarrhea, and she slipped on the diarrhea and fell and broke her hip. Thankfully, when she reached the hospital, the diarrhea had gone away. And the other one, she tripped and she fell. So all 3 of them had surgery within 2 days. The 70-year-old was discharged, and the 80 and 90-year-old, they were fighting, they were critical. And I remember going to their bedside and talking to their family. We got blood for them, and we were basically nursing them back to health. And then I went on vacation leave to attend my graduation when I became a doctor. And during the vacation leave, during the graduation, I met one of my friends, so I asked him for these 2 patients. So the 90-year-old one, who I thought wasn't doing well and she might die, she was actually doing better and walking, and she was discharged. Unfortunately, the 80-year-old one, who I had high hopes for, she died. So her mobility, her death was linked to her fall and her fracture in her hip. So this is how important it is to prevent a fall in the elderly, because a fall could lead to their death, right? So this is why falls matter. So now we come to the common causes of falls, right? So the common causes of falls is weak muscles. So throughout the whole thing, you'll notice a recurring theme. I talk about muscles and having good muscle mass. And this is linked to fragility. Fragility is when a person loses their muscle and they become weak. They become so weak that they're unable to even hold up themselves, so they can fall. Poor balance, right? As you get older, your balance may be affected. Poor eyesight, slipping on a floor or tripping. Medication, so older people are at risk of polypharmacy. Polypharmacy means they take plenty different drugs. Some drugs that may interact with each other and cause the blood pressure to go low, or that may cause dizziness on its own, and this may lead to the individual falling. So how do we reduce the risk of falling? So as mentioned before, we want to exercise. Exercise reduces the risk of falling, right? Then we want to do, you could go on to the next slide, we want to do some balance training. So what is balance training? Balance training is where you walk heel to toe, right? Heel to toe is like, you know, in those movies when you see the police officers stop the individual and they administer a sobriety test, and you have to walk heel to toe. Put your heel against your toe and walk in a straight line, right? These simple things that help to the individual's balance. Stretching exercises also help with balance as you get older. Some individuals who have severe osteoarthritis or other disabilities with their lower limbs, they may need a walking aid, right? So I know some older individuals, once I told an old man, I said, you need to walk with a stick. And he said, well, I go walk with the stick, but when I go in the tongue, I don't want people to see me walking with the stick. They will think I'm old, right? So I tell them, I say, well, when you fall in the ground, what they're going to say? Look at old man fall along in the ground. So it's better you walk with the stick, you know, and do not feel ashamed of walking with a stick or some walking aid if you need it. Proper footwear, right? This is important. Don't wear slippers or shoes that is too big or too small for your foot. Wear appropriately sized footwear, and this will reduce your risk of slipping and falling, right? So make the home safer for the older individual, right? You want to make sure that you have good lighting so that they could see where they're going. You don't want the place to be dim. They could bounce into furniture. They could bounce into, you know, anything that is loose, like rugs. So you want to make sure there is no loose rugs or nothing on the floor that they can trip over, right? Especially in the bathrooms, the restrooms, the toilet, the shower, you could put handrails. So when they're getting off the toilet, they can use these rails to come up from a sitting position, right? Also, non-slip mats in the toilets would, or the bathrooms would make a big difference too as well, so that they do not slip and fall, because sometimes the bathroom may be, the floor may be a bit wet and they could slip easily and fall. So these mats would help this, as working together with the handrails, right? So as individuals get older, they are at risk of certain eye conditions. We had a whole program on eye health in the past. And as you get older, you get risk of glaucoma, diabetic retinopathy. They may have refractive errors, needing glasses to see far or close distances. And they need to get regular checks, as well as checking your hearing, right? You may think, well, why checking your hearing will help with falls? Certain cues in the environment could be picked up, right, from hearing it. If a cup falls to the ground, you can hear that a cup falls, so you will know there's water on the ground. If you do not hear this, you can get up, step into the water, slip, and fall, right? The other thing, as we mentioned before, polypharmacy, where older individual is taking a lot of medications that might interact with each other and cause dizziness, right? Some common examples, some prostate medications, some alpha blockers that individuals may take at night, that may drop their blood pressure. And when they get up, because they have prostate problem, they have to get up in the night to go to use the washroom more often. So you take the medication drop the blood pressure, you get up in the night to go and use the washroom, but your blood pressure is low, you feel a bit dizzy, and you fall. Other medications patients use commonly, things like amitriptyline that might be prescribed to them for sleeping. This may cause them to be dizzy or have headaches, and they can fall. Other medications too might interact. Sometimes patients might be on medications they do not need to be on, and this can be a cause of them falling, and this could lead to, as we mentioned before, a high mortality. It can lead to death. So preventing falls in the elderly is very important. So next time you go to your grandparents' house, or even your parents' house, if you have elderly parents, you watch around, do an assessment, see how can I help to prevent them from falling, right? We spoke about all the measures here. Look around if they have any loose rugs, any lighting problems, all of these things. You make an assessment, and as a younger individual, help to prevent falls from the elderly. So as we move along, we want to talk about a very important part of aging. We mentioned before that lifestyle is accountable for us aging in a healthy manner. And when we say lifestyle, we say lifestyle in the manner that we mean diet and exercise. So we spoke about exercise before, and we talk about how to exercise, what kinds of exercise, and all of these things. So now we want to touch on diet. What should the older person eat, right? Eat for healthy aging. That is what we want to know. Because as we said before, exercise is medicine, but food is also medicine as well, right? And the pervading theme throughout what I spoke about so far is about muscle health. To have good muscle mass. That is an important takeaway point here. So you want to eat foods that would help you to build muscles. You want to eat foods that might be high in calcium to help your bones, right? Because as older people, we have lower density of the bones, right? You want to eat foods that would boost your brain function as well as your immunity to fight off any diseases that you may be afflicted with as you get older. right? So what should you eat more of? What are the healthy foods that you should eat more of? Vegetables, fruits, right? Vegetables go without saying. As older people, sometimes they get constipated. Vegetables have a lot of fiber, right? They do not spike the blood sugar levels because they have complex sugars, not simple sugars, to spike the blood sugar levels in diabetic patients. So vegetables are a very important group of foods that older individuals should eat a lot of. When it comes to fruits, yes, fruits are important and fruits are nutritious. However, people with certain dietary restrictions, such as diabetes, have to be careful in the amount of fruits that they are consuming. So, as I always tell my diabetic patients, it is mango season. Well, we're coming towards the end of mango season now, but it is mango season nonetheless. And you like mangoes, you know, you like starch mango, you like Julie mango. You obviously going to eat mangoes in the mango season. But the important thing is how much you eat, right? How much you eat. So you ain't going to suck 5 starch mango and your sugar 500 and something, you know. You could suck 1 starch mango and your sugar is 100 and something, right? You're eating Julie, eat a half a Julie in the morning and a half in the evening with some other food. Or eat the whole thing one time, but only one. Right? So limit the amount of fruits in certain circumstances, but fruits are a good class of food, for older individuals. Fish is important. Fish has a high protein content, and as we mentioned, protein is important for muscle health. Beans, whole grains, and nuts also have very important nutrients, and they do not spike the sugar as much. And these nutrients would help to support good heart and muscle health with certain natural proteins and oils that you might get from these foods. So protein becomes more important in older individuals, as we say again and again about the muscles. And where do we get these proteins from? You can move on to the other slide. So where do we get these proteins from? From fish, chicken, eggs, lentil, beans, even dairy, even milk has a high protein content. So you want to increase these foods into your diet so that you get a higher protein content. And when you have this, and as in we always say lifestyle, diet and exercise, you have the protein in your diet and you are exercising, you would naturally build muscles or maintain the muscles that you have, which may be a good goal as you get older. Then we move on to how much water you should drink and why it is important to drink water. Now, there are different opinions on how much water individuals should drink, right? Whether it's 8 glasses for the day, whether you should drink water when you feel thirsty, different opinions. However, all opinions talk about the importance of drinking enough water, right? So how much ever it is, make sure that you are drinking an adequate amount of water, right? Make sure that your body doesn't reach the stage that you have to feel thirsty or excessively thirsty then to drink water, right? Because dehydration could cause confusion, it could cause dizziness, right? It could cause headaches, and those things could lead to falls that we are trying to prevent. Dehydration can also cause kidney stones and other kidney problems, right? So we want to prevent kidney problems and kidney stones, right? So the foods that we talk about what we should eat. So now we want to come on the other hand, what we should not eat, the foods that we should restrict as you get older. So you want to stay away from sugary foods, right? Foods that spike your blood sugar levels for the diabetic or even the non-diabetic patient. right? You do not want to spike your sugar as you get older, right? You want to stay away from processed foods because certain processed foods contain chemicals that can damage parts of your body, and you do not want this to happen, especially as you are getting older, right? Excessive salt, right? This is the individual who has high blood pressure, or even the individual that has normal blood pressure. Excessive salt could lead to a higher blood pressure. So you want to restrict the amount of sodium that you are intaking, right? And you may be surprised to know how much salt you are really intaking in a diet. Because in Trinidad, when you're cooking, you put salt when you start to cook, then you put seasoning which contains salt, then you put flavoring to it which contains salt, and then in the end you might still put some more salt, right? So nobody said not to use salt, but use it in moderation. Deep fried foods, right? Trinidad is known for its deep fried foods because they taste so good, right? Every day people have to eat doubles, polori, sahina, kachori, and the list goes on, right? Even bake and shag, the bake is fried, right? So you want to limit the amount of these eating. Nobody says not to eat it, but don't stand up and eat doubles, man, eat 5 doubles, right? You could eat 1 doubles, not every day, but once a week, once every 2 weeks, once you discuss it with your doctor or your dietitian, right? So you want to look after your health as you get older. In Trinidad, they say take in front before in front take you, right? And we say an ounce of prevention is worth a pound of cure, because prevention is better than cure. And you want to check up regularly. You want to screen. We had a whole discussion on screening, and we spoke about screening the older individuals. So as you get older, what is important for you to check, right? You want to check your blood pressure, your blood sugar. How often the blood pressure? Blood pressure, you could check it at least every 6 months, 2 to 3 times to the day, depending on your family history, depending on how the previous reading was, right? If you have a slightly increased blood pressure, then you should check it for like a week. And if it is increased for the full week, visit your doctor. Then how often you want to check your blood sugar? If you have access to a blood sugar machine, check a fasting when you get up in the morning before you eat or drink anything. It should be less than 100, right? If it's less than 110, you have some impairment. If it's more than 120, definitely you need to go and see a doctor. The cholesterol levels at least once for the year, especially if you have a strong family history of heart disease or strokes. Your vision, again, we had another whole program on vision, and the optometrist told us screening for eye disease, especially as you get older, including glaucoma screening, should be done at least once for the year. Hearing is something we do not screen in Trinidad, especially too regularly. However, if you have any hearing problems, or your family might more realize you have the hearing problems because they may realize that they're speaking to you and you do not hear them properly. So somebody else might tell you, no, you're not hearing as good as you was when you was younger. You can visit your doctor and they will advise you on the appropriate screening. Dental checkups, as you get older, you may have different dental problems, gum disease, the teeth itself having caries or decaring, right? So you should always get a checkup. Dentists recommend at least once a year, once every 6 months, depending on your dental health and the dentist that you go to. Now, older individuals have certain diseases that the younger persons mightn't have, things like shingles, right? So I see a lot of cases of shingles, and in first world countries, they vaccinate for shingles. Now, vaccines for shingles are available, however, not readily, and it may be priced out of the range of certain individuals, right? But there are vaccines as you get older, you should inquire about with your physician, with your doctor. The yearly flu shot is available freely in all health centers, right? The pneumococcal too as well is available in the health centers. A lot of old people do not have their tetanus updated, which is an important thing, especially for the diabetic patients. They may be, sustain an injury, and because of not feeling it, they would not know. So it's important that they have all their vaccines up to date, right? So as we spoke before about a little bit about mental health, the mental health in the older individual is really surrounding being physically active and maintaining certain friendships, right? Friendships with younger individuals, friendships with family. So as a young person, you shouldn't say, well, all right, well, cha-cha living in your own world, or me, I want to talk to Mamu, always. You have to be nice to them. You have to be merciful and respectful to the elderly, right? And this would help them to stay positive and manage their stress levels. Sleep is always important. As you get older, you want to get 7 to 8 hours of sleep, right? If you're not sleeping in the night, 7 to 8 hours in total is fine. However, certain individuals have to develop better sleep hygiene. Do not lie on the bed whole day. Do not watch TV on the bed. Do not eat on the bed. You know your bed, when you hit your bed, is to sleep. So maintain the sanctity of the bedroom for sleep alone, right? If you have severe snoring, or you find like you have daytime drowsiness excessively, or you're not sleeping well, you can visit your doctor to discuss those things with them so that you can get the appropriate health care provided to you. So as you get older, every day you get older, you get closer to your death. A lot of people don't like to think about this, but it is the reality of life. And a lot of people, they wait until they get old to get closer to their faith, to their religion. This is not advice, but however close you are, you should try your best to get closer to Allah as you age, because you are closer to your death. So you can think about it in a T20 match, people who like cricket. In the last few overs, the batsmen try to maximize the amount of runs they're making, right? They're trying to build up the score, right? So in your final overs, your final balls, your final years of your life, you want to maximize your good deeds. So as you progress through the different stages of this life into the next life, you can reap the benefit of this life. So there are a lot of downsides to aging, but there's a lot of blessing to aging, as it is mentioned from a spiritual point of view, right? Aging brings wisdom, it brings experience, right? And the opportunity to increase your worship, because as you age and you get older, most people, they retire, so they have more time to dedicate towards the worship of Allah, right? And as I mentioned throughout my presentation, as younger individuals who are aging, and probably not to this stage of aging, we need to emphasize, as it was emphasized by our Prophet, peace be upon him, the role of respect towards the elderly, right? We want to visit them, right? Help your neighbor, help your family, your elderly people in your family, whether it's your uncle, auntie, mother, father, grandfather, grandmother, right? And include the elderly people into the community life, right? Do not isolate them because of their age. So, in closing, 5 healthy habits that we want to incorporate is to move every day, as we spoke about the importance of exercising and movement. We want to eat well, keep learning, stay connected, do not remain isolated, and have regular health checks. So, as we close, growing old is something inevitable. And as mentioned by the Prophet, peace be upon him, all diseases have a cure beside old age. However, we say you may grow old, but you should not grow cool. You need to seek your health while you are young and seek your health while you are healthy. With this in mind, your aging and your life is a amanat from Allah, and you should always take steps to be grateful to Allah for this favor by showing thankfulness to Him and honoring your body and keep it healthy. So until next time, Assalamu alaikum wa rahmatullahi wa barakatuh.